Hey everyone, we are going to take a closer look at the digestive system, specifically at two accessory organs, namely the pancreas and the liver, otherwise known as cabinet 26. We're going to take a look at the pancreas and the liver and how they help with digestion. So first, where are they? Taking a look at our torso model here in the abdominal cavity, and actually the liver is within the peritoneal cavity, the pancreas is not. The pancreas is retroperitoneal. So the liver is covered by peritoneum, by serous membrane. You can see it's mostly in the right hypochondriac region, but it extends into several others like the epigastric, a little bit into the left hypochondriac, and the right lumbar. If you lift it up, you can see the gallbladder, which we will also get into in a second. I'm going to put this to the side. Stomach, we've already talked about that. Take a look at that video if you haven't already. But just underneath behind the stomach, there goes the transverse colon. Transverse colon is right here. Pancreas is right here. This is the spleen. We've talked about that in a previous video. This is the duodenum. We'll get to that. But here's the pancreas, and then again, the liver. So the liver and pancreas are known as accessory organs because they themselves are not in the digestive tract. Food does not directly pass through them. Rather, they secrete stuff into the digestive tract. So the liver produces stuff called bile, stores that bile in the gallbladder, and then the gallbladder secretes that stuff into the duodenum. See that green tube there? That is a bile duct secreting to the duodenum. Whereas the pancreas secretes into the duodenum as well through its pancreatic duct. Let's take a look at this. It's the same thing here. You can see the duodenum on the left, pancreas in the middle. I'm holding onto the spleen. Yeah, pretty good. Okay, so looking at the pancreas, you can see that there's kind of a tail end right here towards the spleen. There's kind of a head end towards the duodenum. This major pancreatic duct leads into the duodenum. And there is a sphincter here. It's called the sphincter of Ambula or sphincter of Vadi. That is a sphincter that regulates the passage of this pancreatic fluid into the duodenum. What is the pancreas secreting? It's secreting from its exocrine glands, which are the acini, not the islets. The islets are endocrine. From its exocrine glands, it's secreting pancreatic juices, which serves to neutralize the acid that's coming from the stomach. The stomach can handle the acid because it produces a huge amount of mucus. The pancreas cannot. So it secretes base, some buffer to neutralize the acid. It also secretes enzymes. Lots of digestion, lots of chemical digestion happens here in the duodenum. So you're secreting that into here to mix with the chyme that came from the stomach. So that's the pancreas. It's retroperitoneal. You can see the tail end by the spleen. The head is nestled in with that C shape of the duodenum. Sharing that tube, that sphincter, and the end here, the sphincter of Vadi, which is the sphincter leading into the duodenum, sharing that is the bile duct. Here you can see the bile duct leading in to the duodenum. And it shares that same hole. That bile duct is leading from the gallbladder. The gallbladder, the word bladder just means a storage space, so it's just a bag to store stuff. Just like your urinary bladder is to store urine, the gallbladder is to store bile. And bile is this stuff that your liver produces. This is a close-up of your liver tissue, liver lobules, and then even more close-up. But these hepatocytes, these cells of your liver, produce a substance called bile. And what bile does is that it emulsifies fats. In other words, it prevents fat droplets from getting too big. Like if you set oil out in a watery solution, like your salad dressing, the oil tends to clump together. Bile would prevent it from clumping together. It increases the surface area of fats that you eat, making it easier to digest. So these hepatocytes produce the bile, secrete into these ducts, make their way to the bile duct. The smaller ones are here, shown here in green, same one, it's zoomed in, and then stored in the bile duct or gallbladder and then secreted out when it's ready, when it's time to digest. And so you can see on the back here's that bile in green, here's that bile duct going into the duodenum. That is the function of bile, the basic function of bile, produced by the liver, stored by the gallbladder. To find the gallbladder, it's just lift up, look on the inferior aspect, you can see it right there. So here's the gallbladder and the bile duct. Now, as far as how is the liver organized, it's a really important organ. It's used for many different things, it's used for storing nutrients. It's used for detoxifying. Really, really important organ. How is it organized? How does it do those things? Well, when we digest things and absorb those nutrients, the stomach isn't absorbing nutrients. It's just for digestion. So food moves from the stomach, gets digested partially. We send that food to the duodenum for more digestion, thanks to the bile from the gallbladder and the pancreatic juices from the pancreas, and we get a lot of digestion and mixing. We start to absorb those nutrients in the jejunum and ileum mostly, jejunum especially, because that's right after the duodenum where most of the digestion happened. And so this is representing the jejunum and ileum, like right here. That stuff gets absorbed through fenestrated capillaries, which I guess I can show you here. This is representing the intestines. This is representing the intestines. These are capillaries of the villi of the small intestines. They're fenestrated, meaning they have small pores. Not so big that they can let cells in, but big enough that they can let macromolecules in, nutrients. So absorbing most nutrients through the capillaries, the fenestrated capillaries, or even the lacteals, but let's focus on the capillaries. This is the superior mesenteric artery. This is the inferior mesenteric artery. Superior mesenteric, inferior mesenteric, coming from the intestines, upper part, lower part. And this is the celiac trunk going to the stomach. This is the gastric artery. And then there's one for the spleen, the splenic artery. But anyways, all these arteries, gastric artery, splenic artery, superior mesenteric, inferior mesenteric, they all lead into the liver. Here's a blown up version of the liver, I guess more realistic. And if you lift up, so this is anterior, look on the inferior aspect. So this is posterior, this is anterior. This purple one is representing the hepatic portal vein. The celiac trunk and the gastric arteries, splenic arteries, the superior mesenteric artery coming off of the aorta, the abdominal aorta, and the inferior mesenteric artery coming out of the abdominal aorta. These all branched capillaries in the intestines, for instance, and then from the capillaries it branches to the hepatic portal vein. Hepatic portal vein. It's important to say portal vein because there is a hepatic vein, which is over here. Hepatic portal vein delivers blood and nutrients to all over the intestines. You can see all the purple branching. It then branches, so we're zoom in to just a lobule here. Here's a bunch of lobules of the liver. They're hexagonal shaped. It's these purple ones at the corners of these hexagonal lobules. Those are branches of the hepatic portal vein. And so zoomed in here, branches of the hepatic portal vein. These then branch to capillaries. These are sinusoid capillaries. And in these sinusoid capillaries and the hepatocytes here, we're absorbing nutrients for storing for later, or we're taking toxins and detoxifying it. We want to take any of the nutrients that we absorbed from the intestines and storing them for later, or taking any toxins that we just absorbed and detoxifying them because we don't want it to get to the rest of our body. So the liver acts as a filtration before we get to the rest of our body. We don't want to damage anything else. The liver takes a hit. So when you drink alcohol or other things harmful to your body, your liver's the one taking the hit. It's the one dealing with all those toxins. So be nice to it. Okay, so we've gone from the hepatic, this is a branch of the hepatic portal vein, to the sinusoid capillaries. That all then drains to this middle blood vessel. So this is just a fraction of that. This middle blood vessel is a branch of the hepatic vein. Hepatic vein, it's the central vein of this hepatic lobule. It's different from hepatic portal vein. Hepatic portal veins are formed in these portal triads where you have a bile duct, hepatic artery branch, hepatic vein, portal vein branch. This is just hepatic vein. Hepatic vein is draining blood away from the liver. Hepatic portal vein brought blood to the liver. So we bring blood in, goes through sinusoid capillaries, and then we drain out through the hepatic vein. This is representing the hepatic portal vein. We branch sinusoid capillaries and then come back here in blue. This is representing hepatic vein. Looking at the back of the liver now, the posterior side, and you can see a branch of the hepatic vein right here, another branch over there that leads to the inferior vena cava. And the inferior vena cava, you can see right here, then returns blood back to the heart. So to recap that one more time, pretty confusing, I know, there's a lot going on here. Blood from the celiac trunk can branch to the gastric artery, to the splenic artery, or even the hepatic artery, the direct hepatic artery, hepatic common artery, that goes directly to the liver. So we have blood from the celiac trunk, or superior mesenteric artery, or inferior mesenteric artery. It branches to capillaries, say fenestrated capillaries of the intestines, and then it branches back to a hepatic portal vein. From the hepatic portal vein, we branch to sinusoid capillaries. Then that drains from hepatic portal vein, sinusoid capillaries, to a branch of the hepatic vein, shown here in blue. Hepatic vein returns to the inferior vena cava and drains back to the heart. In red, that's representing hepatic artery, and so these are branches of the hepatic artery. Green is representing bile ducts and branches of the bile ducts. So bile ducts are separate from circulation. If we're looking just at blood circulation, in a lobule, the center is hepatic vein, not a portal vein. So this is draining blood out of the liver. Bringing blood into the liver are both what's here in red, that's hepatic artery branch, and in purple, on the corners of the hexagon, that's hepatic portal vein branch. Both hepatic artery and hepatic portal vein branch bring blood to the liver. Central vein, it's a branch of the hepatic vein, drains blood away from the liver. And then bile ducts are just separate. So these portal triads, bile duct, hepatic portal vein branch, hepatic artery branch. In the center of that lobule, you've got your hepatic vein. And then sinusoid capillaries that go from these arteries, artery and portal vein, to the central vein, and then bile ducts that actually go that way to store bile in the gallbladder. Lastly, thought we were done, we're not. Lastly, how is this liver organized at a gross anatomy level? So this liver would fit in here. The liver is divided into 4 lobes. The main lobe is the right lobe, the large one. Here's the left lobe. If you ever donate a piece of your liver, you donate a piece of your left lobe typically. Your liver can regenerate to an extent. You can't give away the whole thing, but you can give away a little bit. What's separating the left and right lobes? This is called the falciform ligament. Separating the right and left lobe. It's not a true ligament like bone to bone, but it's this connective tissue that's separating the lobes. On the inferior side, we can see here this, what's labeled as 8. This is the round, this is the round ligament. No, that's not the round ligament. This is the, it used to be let me say this so I don't mess it up. Okay, I'll just say what I can say right now. What's sticking out, what would be sticking out would be the round ligament, ligamentum teres. That used to be the umbilical vein. This used to be the ductus venosus, but now in adults, once we're born, this fuses together. This becomes a ligamentum venosum. It used to be a shunt to go straight from the umbilical vein to the inferior vena cava to bypass liver the liver, since your liver is not really functional as a fetus. So this used to be ductus venosus. It's now ligamentum venosum. And it does stick out. We don't have that model here, but it does stick out. That's called the round ligament and or ligamentum teres, and that used to be the umbilical vein. Making sure I covered everything. Oh, right. There you have the right lobe. You have the left lobe. The one closest to the gallbladder, this is the quadrate lobe. It's just this small lobe on the underside. This is the quadrate lobe. More towards the inferior vena cava, that's the caudate lobe. Think cauda, like towards the tail. This is posterior. It's deeper by the inferior vena cava. This is the caudate lobe. Right lobe, left lobe, quadrate, caudate. All right. I think that's it. There's a lot. Liver and pancreas are really important. So is their circulation. Please let me know if you have any questions, if you need any clarifications. Thank you for watching.